My name is Maria Caruso, and I am your Orthopedic Patient Navigator. It's no doubt that navigating our healthcare system can be challenging at the best of times, which is why I'm here to help guide you. I can be your dedicated contact and support person throughout your entire surgical journey. It is very important for patients to be well prepared in the days leading up to their scheduled hip or knee replacement surgeries. Planning prior to surgery is very important, as it will ensure a smooth and easy discharge after surgery. It's no surprise that patients that do their part in preparing themselves ahead of time for their surgery feel less stressed and anxious and are well prepared for their discharge home. Patients having a scheduled hip or knee replacement surgery should plan to be discharged home on post-op day 1, in other words, the day after your surgery. In some cases, patients may be appropriate for same-day discharge. Your surgeon can discuss this with you. By day 1, you should be able to get in and out of bed independently, walk short distances, dress and toilet yourself, and on the day of discharge, you will even be able to manage getting up and down a few stairs. Although you will be relatively functional at this point, it is important to note that there are a few things you still may need some assistance with. For example, meal preparation. It may be easier to have someone assist you with meals initially, mainly because you may be uncomfortable standing in one spot for an extended period of time. And also, you will be using a 2-wheeled walker, which can make it difficult to carry ingredients from the fridge to the sink or the stove, and so on. And your safety while using the walker is most important. If you live alone, it may be a good idea to prepare some meals ahead of time that can be frozen and easily reheated once you are home. Another thing you should plan on getting help with after surgery is transportation. You will not be able to drive for at least a few weeks after your surgery. Your surgeon will advise you on when it is safe for you to get behind the wheel again. And this likely won't happen until your first follow-up appointment, which may be anywhere from 2 to 6 weeks post-op. Until then, please ensure that you have made arrangements to get you to and from your appointments and anywhere else you need to go. For those of you that are caregivers to others, such as children, grandchildren, elderly parents, or spouses, and even people with pets, please ensure you have made alternate arrangements to help care for these loved ones, as you will only be able to look after yourself initially. If you live alone, now is the time to start making arrangements for some of the things we have just reviewed. Asking family and friends, neighbors, church groups, and other social groups for help is recommended. Although you don't need to have someone with you 24 hours a day, it is recommended to try and arrange for someone to stay with you for at least the first few days until you have established your new routine and are feeling more comfortable and confident getting around on your own with your new joint. When you came to our OJAC Center for your initial consultation, you were given a total joint replacement patient guidebook. If you did not receive this booklet or you have misplaced it, you can find a link in the description below. This book contains a lot of important information to help you prepare for your surgery. It is also a great place for you to take notes or write down any questions you may want to ask your surgeon or other surgical team members. In it, you will also find important contact information. It is important for you to have a thorough read through your guidebook in preparation for your upcoming surgery. And as always, if you have any questions or concerns, please do not hesitate to contact your navigator. As we have discussed, home is your #1 option at discharge, and our team will do our best in partnership with you to ensure that we get you home safely and confidently after surgery. In some cases, where patients have concerns about going home or lack social supports, a respite stay in a retirement home may be an alternative choice. Your navigator can provide you with more detailed information if you feel that this is a better option for you. Please keep in mind that respite stays in retirement home settings are not covered by OHIP or any other insurance plans. These are private pay facilities that can offer a wide variety of services to post-op patients, including nursing and PSW supports, meals, and housekeeping. It is important to note that inpatient rehabilitation is not a discharge destination and cannot be pre-booked under any circumstance. If the surgical team does not feel that you have adequately progressed in meeting your goals after surgery, your team will meet with you to discuss whether or not inpatient rehab is recommended. Otherwise, all hip and knee replacement patients are expected to attend follow-up physiotherapy at an outpatient physiotherapy clinic. A link to our list of clinics is available on our website or in the description below. It is important to note that most clinics will start off by seeing patients 1 to 2 times per week until the acute goals of outpatient physiotherapy have been met or you have reached a plateau in your progress. Here at Markham Stouffville Hospital, we are part of the bundled care model for hip and knee replacement surgeries in Ontario. This integrated care pathway for our patients starts from the time you are admitted to hospital through your recovery in the community. As part of the program, Markham Stouffville Hospital will provide payment for outpatient rehabilitation services provided for our patients at one of our contracted physiotherapy providers. Your navigator will assist you in finding the clinic that best suits you. In some cases, patients may opt to use a private clinic of their choice, in which case Markham Stouffville Hospital cannot cover the cost. Once you have had your surgery, your navigator will meet with you to review your discharge plans and assist you in sending your referral to the clinic of your choice. Please note, there's no rush to make your physio appointment until you have had your surgery, as your referral will not be available from your surgeon until you have already had your surgery. Your navigator will facilitate this for you prior to your discharge home. Patients undergoing total knee replacements are to start their outpatient physiotherapy within 7 days after surgery. Patients undergoing total hip replacement surgeries do not need to start outpatient physio until after 2 weeks. Finally, to recap, your estimated day of discharge will be post-op day 1, or the day after surgery. Discharge time is before 11 a.m. Please ensure that you have arranged for a ride home on the day of your discharge. Once you are admitted to your room, have your caregiver bring your two-wheeled walker to the hospital. This will allow our surgical rehab team to adjust it for you, show you how to use it, and give you an opportune chance to practice using it before you get home. You will also need it to get in and out of the vehicle when you leave the hospital. Once you are admitted to your room, where you'll be spending the night, have your caregiver bring your two-wheeled walker to the hospital. This will allow the team to adjust it for you, show you how to use it, and give you a chance to practice using it before you get home. You will also need it to get in and out of the vehicle when you leave the hospital. Make sure you've thought about which clinic you'd like to attend for your post-op physiotherapy. Your navigator will help you arrange this. Remember, chances are you won't be driving by the time you have your first physio appointment, so make sure you have arranged a ride to get you there and back. And lastly, if you have any questions or concerns leading up to your surgery, please do not hesitate to call your navigator. The contact information is in your patient guidebook or on the screen. In the next video, you will hear from one of our surgical nurse practitioners who will discuss with you the post-surgical wellness clinic and some other things you may need to know.